Today we're here with Morgan Fitzgerald. She's going to guide us through exploring the relationship between pain, chronic pain, and visual art with the goal to find a creative outlet to express and cope with it. Before we start, I just want to share a few upcoming programs that we have that are kind of in a similar format to this. Some are virtual, some are in person. This program was made possible by the generous support of a private donor. So thank you to that donor. And it's part of a series of conversation among artists, scientists, healthcare providers that kind of happens at the same time of the Chronicles of the Chronic exhibition. The Chronicles of the Chronic is a group exhibition. It celebrates the creativity and resilience of the chronically ill community, and it features regional, national, international artists whose practice reflects holistically upon the experience of living with chronic illness. The show is still up, so feel free to come and visit it until the end of March. Today we're here with Morgan Fitzgerald. Welcome and thank you for being with us. We got connected kind of weirdly through like a common, let's say, friend. She is a neuroscience PhD student. She's also the host of a really amazing podcast called The Chronic Connection. You can see more about her life, her art, her work at Life with Migraine, her Instagram account, where she truly advocates for herself and for others with illness. So as an emerging artist and a patient advocate, Morgan is driven by the powerful intersection of art and advocacy. Living with chronic pain since the age of 12 has been enduring and arduous journey for Morgan. By intertwining art, her personal experience, and her advocacy work, she strives to amplify the voices of those living with chronic illness, spark meaningful conversation, and drive positive change in healthcare and society. And I'm just really grateful to be able to learn today from such a wonderful artist and scientist, really at the intersection of the two things. So I'm just going to let you do your thing.
Thank you, Zoe, so much for that introduction. Very kind. I'm really excited to be here this morning. This is a really cool exhibition that's gone on at the Rochester Art Center, and I'm honored to be able to contribute to it with some online programming. Today is a workshop associated with Chronicles of the Chronic, and it's called Exploring Healing Through Art. And these two photos on the right are actually images of works that are in the exhibition, which you will see throughout this presentation. Just as Zoe said, if you can make it there, highly recommend. It's a fantastic group of artists and also works. So Zoe gave a fantastic introduction, but just who am I? A little recap. As they said, I'm a neuroscience PhD student and researcher, which means most of my days look like this, staring at a computer. I'm coding, I'm looking at data, trying to understand the brain and answer some big questions about the brain. And I would say on the side, but I would say 50% of my passion is also contributed and poured into my chronic pain and migraine advocacy. I founded Life with Migraine in 2018, which is a chronic pain and migraine platform for women navigating life with these conditions. I'm on Facebook and Instagram, and then also my website, which is lifewithmigraine.co. And then, as Zoe also mentioned, I am the host of the Chronic Connection podcast. This was a true passion project that erupted during COVID, and it has some really special conversations on it with people who experience all types of chronic illnesses. And it's currently paused for episode production right now, just because grad school is a little demanding, but I'm absolutely going to pick it back up very soon. It was a treat to be able to speak with individuals who have shared experiences. And all of this is largely because I am also chronically ill. I had my first diagnosis when I was 12. And to make a very long story short, I ended up becoming extremely ill around my 21st birthday. That led me to be bedbound for 2 years. And I spent the next 4.5, 5 years of trial and error of every doctor and remedy you can think of to try to get back on my feet, which I'm very happy to be managing well today. Despite that, though, I still manage chronic illness every day, every week, every month, and every year, even though I am managing better. So chronic illness is still very much at the heart of what I do day to day. So yes, welcome to the workshop. On the right, you'll see what you need. Basically just paper, something to put on the paper is how you can think of this. It's totally up to you for what that can look like. We will do some creation at the end. Whenever I'm sitting through a presentation, I need a roadmap. I like to know where we're going. So I just wanted to give you guys a little bit of a preview. We're going to talk about chronic illness today in the US, just to get some stats down so we're all on the same page with how prevalent this is. Then we're going to talk about what is art and how that plays into artful healing. Then we're going to talk about my favorite thing, which is your brain, and how art interacts and changes your brain. We're also going to talk about how art changes and breaks stigma and can help with rebuilding identity, which is extremely important when people are saddled with chronic illness. Then we will have some time for your own creation before moving into some discussion. We'll come back. You can share what you've created or maybe some of your thoughts, and then we'll have open Q&A at that time. Okay, so chronic illness by the numbers. What is chronic illness in the US these days? So we know that 6 in 10 adults in the US have chronic disease, and 21% of US adults, which is about 51 million, have chronic pain, which is a number too large for my brain to compute. And oftentimes, I think we forget that children also suffer with chronic conditions, and 27% of children are estimated to have a chronic condition. So this is something that is not unique to adults. It's affecting all generations and is of perhaps greater importance to understand these conditions earlier and make sure that children don't deal with this for as long as many adults do. So then the toll. And when we talk about the toll of chronic illness, I think oftentimes it's easy to think about maybe the physical toll. The person is experiencing pain, or the person is experiencing nausea, or maybe tinnitus ringing in the ears. Those are maybe things that you have experienced that you may or may not be related to chronic illness. But I think we often miss the conversation in terms of the mental toll. And I wanted to pull out this statistic because I think it underscores just how heavy chronic illness can be for those who are struggling with it, because chronic pain patients are at double the risk of suicide. And we have a lot more research on chronic pain, so you'll see me refer back to pain throughout the research. It's also my most familiar area of research, but you can take pain and replace it with a lot of different conditions, and these stats would be very similar. And then there's also the economic toll. And I think this is perhaps not the most important one, but it also is one that kind of, I think, puts it in perspective. And so including indirect costs with lost economic productivity, the total cost of chronic disease in the US is 4 trillion per year. That is too big of a number for me to even comprehend. But if you think about it as 20% of the GDP, I think that puts it into perspective of just how big this is and just how honestly damaging that chronic illness is on all fronts. So now into the art and healing and artful healing. I don't think we can talk about artful healing until we actually talk about what art is, and I feel like we're all on the same page about how we feel and look at art. Just to cover my bases, I did look at the actual definition of art, and it's just the conscious use of skill and creative imagination, especially in the production of objects. Okay, that doesn't mean a lot. So then I thought about what art means to me, and I came up with 3 pillars. And so first, I think art is community. I think the collective observation of an object promotes feelings of unity through shared appreciation and global understanding of the human experience. I also think art is conversation. I think it's an absolute catalyst for conversation that sparks insight and novel insight of maybe things that you've looked at before, and novel thoughts and experiences while observing maybe someone's human experience. And then the third is expression, which is, I think this is the one that people think about most when they think about art. It's individual or even collective expression, which really represents these human narratives. And again, it comes back to this idea of encouraging new insights and kind of provoking thoughts and conversation. So these are the 3 pillars of art that I think actually really play into this concept of artful healing. The intersection of art and chronic illness. You may already know this, but art has been used as therapy, and there are many stats, and there's actually quite a bit of research that I could pull out, but one study that I found is that art therapy actually really improved mood and reduced pain and anxiety ratings in patients that were offered art when they were in the hospital for an acute treatment. They had an acute illness, and this covered a range of illnesses. I thought this was really special because it wasn't unique to what they were struggling with, but their reports of improved feelings and reduced suffering were pretty consistent, which suggests that art can really help regardless of what you might be struggling with in terms of health. What I really liked is that the key here is like participation. Participation is powerful. Research has found that the act of participating in art making actually has the potential to distract from and thus alleviate the perception of physical pain. Note here, and in the next few slides, again, I'm going to talk about pain just because that's what the research studies actually cited. So to be completely correct, or accurate, I should say, I will continue to cite pain, but you can replace that with any visceral symptom, again, it could be like nausea or ringing in your ears or fatigue, anything that kind of steals your attention, you can replace with this word pain. Art heals, and one of the ways it does this is that it actually changes your brain, which this is probably my favorite thing to talk about. How does this happen? Well, first we have to understand what sensory attention is. So sensory attention is the ability to see, hear, or become aware of something through the senses. For example, pain intensity is linked to the level of sensory attention it requires. Another way to think about this is the degree to which your pain or symptom is distracting you is associated with the degree to which you will report being like uncomfortable. So if it's really distracting and I'm not able to focus on something else, I'm more likely to rate it maybe as an 8 or a 9 out of 10 versus something that's more in the background. How does art help then? Where does art come in? The question might come up, is art directly changing your pain? Is it curing? Is it, somehow, could it be considered a treatment? And the answer is it's not a cure, and it's not actually exactly changing your pain. And this is a really nuanced point that I looked for a graph to help me explain, and I found one, and I'm so excited I found it. So we're going to walk through this just for a minute. So this is a chart of pain, which is in the dark blue, and then suffering, which is in the light blue. And you can see the pain onset at month 0, it ticks up. And then as you progress from acute to chronic to intractable pain, as the months continue, the pain level doesn't change. And there's not an absolute increase in pain. It does oscillate a little, but you're not having a positive slope. It's pretty flat. But what you notice is that the light blue, the suffering, is actually increasing almost exponentially. So we've seen in research that people who are saddled with a chronic illness, even though their symptoms may not change too much throughout the years, what you're seeing is that there's a really big increase in reports of suffering, discomfort, unhappiness, all of these. The mental and emotional side of chronic illness really swells and becomes more and more difficult, especially because patients aren't given tools for how to cope with this. And they're not told about this, but for their perception, it feels like their symptoms are getting so much worse. But there's really this distinction between the mental and emotional discomfort and what could be a physical discomfort. What's really cool is that there are tools that can help you at least temporarily kind of alleviate this level of suffering, and art is very much one of them. So where art comes into play is really dampening this perception of illness and discomfort, and it's pulling down that level of suffering, which I think is something that is so powerful for people who are sometimes very miserable. Art shifts our sensory attention away from discomfort and reduces experiences of suffering. That's what this graph is saying, if you prefer words rather than images. So the neuroscience of art, I have to bring in a little more brain science for you just to really prove to you that this is doing something in your body and in your brain. Participants were instructed to view art, and they were instructed specifically from one art piece, just a painting, to emotionally engage with it, meaning they were instructed to try and understand what that artist was trying to convey in terms of emotions. In another artwork, they were instructed to view in a detached manner. Just look at it, but don't try to emotionally understand it. What they found was in the emotionally engaging cohort, the regions for reward, emotion, and pain were highly active. And these are all the regions that come online when we have reduced suffering. And this is a study from 2009 if you're interested in reading it. And then there was another study done when people were just creating art. And this one was you can color, doodle, or even free draw. And this resulted in significant activations in the same happy centers, the feel-good centers of the brain, compared to conditions of just being at rest. And this was a study from 2017. So what you're seeing here is that emotional engagement with art, as well as actually creating the act of physically engaging with it and doing your own art, is really quite a powerful way to change your brain and bring on these kind of what you can think of as feel-good centers in your brain. And if you're wondering about methods of art, if drawing isn't for you, or if you don't like paintings, that's okay, because pretty much every method of art has been studied, and all of them pretty much do the same thing. So whatever one feels best to you is the one that you should enjoy, pursue, and engage with. We talked about some brain changes, and now I want to talk about how it can help us heal because it dispels stigma. What is stigma? There are a few types of stigma. Before we can even get there, I wanted to highlight what the World Health Organization calls as stigma. And stigma is basically a mark of shame or disgrace or disapproval that results in an individual being rejected, discriminated against, and excluded from participating in a number of different areas of society. That's a very broad definition, but I think that's not as tangible as understanding a few different types of stigma, because I think the types of stigma help us understand how it comes into play in our day-to-day life. And there are three main types of stigma. One is public stigma, the circulation among the public of negative attitudes and stereotypes. One example that's easy for me to think about is in terms of migraine. A lot of people think that it's a general or benign headache rather than a neurological disease. And people also think that, or often use it as almost like an excuse to get out of doing something. And so that would be considered public stigma against migraine as a disease. There's also structural stigma. So this is organizational attitudes and policies. Another example under the migraine umbrella is that I know people who have asked for like a non-fragrance policy at work, and I've had a lot of pushback. Fragrance can be really triggering for someone who has kind of a heightened awareness of smells and can trigger migraine attacks. And so that is a reasonable request for work, but a lot of times there's pushback from the institution. So this is an example of structural stigma. Both of these funnel into the third one, which is internalized or self-stigma, which is really the most harmful in the end, although it doesn't stand by itself. It wouldn't be there without the first two. And so this is when individuals absorb negative attitudes and apply them to themselves, and they anticipate rejection or they anticipate the discrimination, which holds them back in many ways that we're going to talk about. How does stigma impact people with chronic illness, and how prevalent is stigma? One, it's very prevalent, unfortunately. Reports estimate that half of adults living with chronic illness feel stigmatized because of their chronic condition. And then again, in terms of stigma and chronic pain, almost 40% of individuals with chronic pain report experiencing stigma. So this is something that we have anywhere from 40 to over half of people with chronic illness report that they feel stigmatized. Again, how does this play into care, treatment, life with chronic illness? Why is this important? Well, we don't talk about it just because it's obviously stigma isn't good, but it actually has really, really big treatment implications. And it comes into play when you think about treatment avoidance, because those who experience stigma tend to avoid treatment. And when they do seek help, they often have worse outcomes. There are a lot of speculations as to why those worse outcomes come about. Could it be that they're not asking for as much? Could it be that they're not as strong of advocates for themselves because they don't believe that they deserve that much care or that quality of care? I think there's a lot of intersections of self-beliefs that come in when we think about treatment avoidance, but this is a really important one to be aware of, even yourself, if you do have chronic illness, of when you are seeking care, and make sure that you are not holding back from seeking treatment just because you believe that you will not get it. And then again, this internalized stigma as a result has also shown extremely prolonged recovery times. This is delaying treatment. This is delaying making the appointments. This is delaying picking up medication. We see these delays, kind of avoidance of the individual with chronic illness all throughout kind of the timeline. So this is something that to be aware of if your friend has chronic illness. It's something that we should be talking about. So I wanted to give an example of some good news in the sense that art really can help break stigma and really has the power to reshape perspectives on chronic illness. And I wanted to hit on an historical example of this because we know that art can be a powerful tool in combating stigma around chronic illness. And it does this by addressing misconceptions, it fosters empathy, and really does reshape the societal perspectives. And what you're seeing on the right is a work called The Quilt, which was first established and created in 1985 by a man named Cleve Jones. And Cleve was a longtime human rights activist and author and lecturer, and he was really struck by the AIDS epidemic in San Francisco in 1985. He actually just got together with a group of strangers at the park and a few friends and ended up creating this quilt to commemorate the people who had been lost and to make sure that history didn't forget them. And this was at a time at which AIDS and HIV were really stigmatized, and people didn't want to fund it, they didn't want to research it, they didn't want to talk about it. It wasn't anything that was public. And then here was this group of people creating this really massive, vibrant quilt in the middle of San Francisco and bringing attention to it. This is really cool because this actually not only changed the frequency of conversation in the public sphere around HIV and AIDS, but it also ended up changing research funding. You can see a stark increase in funding, conversations, and it really was the start of the shattering the stigma around this, what can be very deadly illness. So then I wanted to highlight two works that are actually in the Chronicles of the Chronic exhibition that I think are also on the same vein of breaking stigmas and really kind of pushing us in the direction of having the right kinds of conversations. The first one, this is one of my favorite ones. This is called Recovery Position by Anna Height. This is an inflatable mattress that is blue, and I think she called it cyan. You can see kind of in the photo on the left that it almost looks like there's an imprint of a person laying there, which is, I think, a very powerful capturing of life, what life with chronic illness can be when you're, especially as someone who has been bedbound. I think there's a few ways that this is actually pushing into the stigma breaking realm. And one is this idea of visibility and imperfection. This art really brings visibility to aspects of life that are so often overlooked and hidden. This is, again, the idea that chronic illness is so often happening behind closed doors and isn't something that is really brought out into the open, and especially in the bedroom. And so here is something that is seldom seen by the public, and it's kind of laying in the middle of this really empty space. And it's the only thing that you have, like, almost the option to look at on the floor. By portraying the bed as both, it's an intimate sanctuary, but it also is like very confining. It's really kind of capturing the complexity and the duality of chronic illnesses. I think it also is challenging these societal norms because it's kind of challenging the choice to focus on perfection and health, and this kind of health. I think as a society, we're talking more and more about health and optimizing health, and that's not really accessible for a lot of people with chronic illness. I really liked this because it's highlighting the idea of we can accept imperfections in things that aren't necessarily idealized. And then again, I think it's breaking some taboos. I think this piece aligns itself with a lineage of female and queer self-portraiture, which has a long history of breaking taboos and being quite bold in their statements. And then it also aligns with the broader movement of art to challenge traditional narratives, as similar to the quilt from 1985. And so the second work I wanted to highlight from the exhibition is called The Nightstand Collective, and this is by Geography of Illness, or Emma Jones. I think this hits on the ideas of resilience and adaptability. So this work really explores resilience and adaptability of kind of like the human experience and the human persona, and especially in the face of challenges posed by chronic illness. And I think it's a very tangible representation of everyday struggles because these are all photos of people's nightstands. And everyone knows what a nightstand is. Everyone knows what they have on their nightstand right now. And this is such a humanizing way to visualize chronic illness, humanizes the experience. And I think that feeds into fostering empathy because someone can look at and say, like, wow, I don't have quite that many medications or machines or, mobility aids on my nightstand as maybe someone else who's suffering with chronic illness. And this is also a huge conversation starter. I think this, again, is highlighting common ground, which is kind of like the first way to open the door for conversation. And then also it highlights the complexity of illness care and visibility. Again, this is all the nuanced medical devices and treatments that you can see on these nightstands that's often hidden behind these closed doors. But it comes back to the idea that we need to dispel stigma because it has egregious effects in terms of treatment and care and recovery, and works like this that are really bringing things that are often hidden away out into the limelight and into the public for viewing and observation really is a powerful way to start the conversation and start changing this kind of societal narrative of stigma. So we've talked about brain changes and we're talking about a little bit about how art has dispelled stigma. And now we're going to talk about just a little bit about reclaiming identity. And I thought this was a really important thing because this is a aspect of chronic illness that I really struggled with. It's really tough when your body changes without your permission and you are kind of saddled sometimes with a health condition that you never anticipated. And you have new limitations and you have to figure out who you are within those limitations. Maybe you can't do your hobbies or your career anymore, and you have to find this whole new set of things that we so often ascribe our identities to. The experience of chronic illness can significantly impact one's identity and really lead to the sense of loss that is outside of the physical symptoms. Artistic engagement has actually, per research, been shown to really contribute to a very positive identity reconstruction, even when someone is in the depths of illness. And we know that art making, so again, this idea of like creating and engaging with art, can provide a sense of personal growth, achievement, and connection. So again, kind of filling those holes of loss when maybe you're not able to achieve or connect in the way or with the same people that you were able to before. And then finally, art making can express complex, deep-seated emotions that words often cannot, and provides a bridge between the conscious and unconscious. And this circles back again to the idea of you are giving yourself a tool to kind of shift your sensory perception and reconnect with yourself in a way that is independent of like accomplishment, which often is, again, can be very hard when you are limited by your health. So in summary, we know that art actually can contribute to healing in a really profound way. We know that it activates these feel-good centers of your brain, the medial prefrontal cortex and reward centers, if you are any kind of a neuroanatomy junkie. It also does this. The key of this is that it's an emotional engagement. Just passively viewing didn't work. You have to try to emotionally engage, try to evoke emotions within yourself that you think the author was trying to convey. And then also creation is a fantastic way to engage with art and to get truly your brain engaged and get those feel-good reward centers to come online and kind of reduce your own perception of suffering. And then also art can help break stigma. This is a really powerful way to start conversations around things like chronic illness that are so hidden away and stigmatized. Again, one of my favorite historical examples is the HIV/AIDS quilt. And then it also can contribute to rebuilding identity. In some, I think it just creates community, it starts conversations, and deeply promotes empathy. And so now I want to give you guys some time for creation, because we know that creation can actually change your brain. So we're going to spend the next, we'll say 15 minutes, really bringing your reward centers online. I suggest taking a blank piece of paper or something to write or draw with and fold it in half. And on the left side of the page, I want you to express what chronic illness feels like to you. I want you to try to imagine, how can I convey the emotion of my experience to someone else who is emotionally engaging with my art? And then on the right side of the page, express how you think society and external points of view see your chronic illness. So what is the internal perception and emotional experience versus the external? And then after a few minutes, we'll come back. You're welcome to share what you've created. We can even have a discussion about how you think you emotionally engage. Do you feel any different? To kind of take note of where you're at now versus where you're at in 15 minutes. And then there will also be time we can loop that in with the Q&A. And so we will start that time now, and then we'll come back for discussion in, we'll say 15 minutes from now. Okay, so that's the 15-minute mark. I'm going to ask everyone to pause their creations. Know that you're more than welcome to go back to them. And I would love to hear what you created and how you felt. And then if you have any questions, free to just speak up, turn your audio on, or I can now see the chat. So you can also put it in the chat if you prefer not to be recorded.
I'm happy to share if no one else wants to.
Awesome. Go ahead, Kate.
So on the one side, the first thing that came to mind, so I have rheumatoid arthritis and lupus. I've had them both for, 25 years. So the first thing that came to mind was heavy. Invisible is what I wrote over here. One of the things you were talking about with stigma kind of hit me, because a lot of times people say, but you don't look sick. And often I have to say, that's because you don't see me when I don't feel well. You see me when I feel okay. I don't leave my house when I don't feel well. I put isolating, unpredictable. There, now I can kind of see myself better. So then when I went over to the kind of what society looks, some of the things that I've heard is like you're faking it, or it's in your head. you can kind of just think your way out of it. I've also been like ignored when I've said, these are the things that I'm experiencing, lazy. And that art installation with the bed that was really huge. And the nightstands too, like really hit me, misunderstood. And so someone saying to me, oh, is it like this? And it's like, no, it's like this. So I realized too, I didn't really put any of the positives on here. I know it seems odd, but there's a lot of like resilience and some other really positive things in a way that have come out of it. I'll add those when I keep working on it. Thanks for letting me share.
No, that's fantastic. Thank you so much for sharing. And I think one thing that I'm struck by immediately is how similar our experiences are despite having completely different conditions. And again, just comes back to like how art is like so unifying, because I can relate to everything you just said, but I don't have RA. And I think it's interesting that art for me also oftentimes is focused on the negative. That's my initial creation, is often like to get out the icky stuff, almost is like a poor way of saying it. But I'm curious how did you feel now? It's almost like journaling in a way of getting it onto paper and, almost out of your head. I'm curious what the kind of emotional experience of even just in a short time was for you.
Yeah, it's interesting. So when I first sat down, I actually had the feeling of heaviness on my back. And some of it is because stuff I did yesterday. On the one hand, I'm feeling lighter in my body. And then on the other hand, like I noticed, I looked and went, okay, this is all negative. What am I going to put here that's positive? And so I do think that getting all the crap out is really good for then turning and seeing, okay, what are my blessings? And a lot of times we're told not to compare our illness to somebody else's illness, but kind of like you were saying with those nightstand pictures, sometimes it is good to say, hey, you know what? I can walk. So I have my 84-year-old mother living with me who has RA. And there are things where I look and go, okay, you know what? I can still really use my hands. She can't come down here and create art. Really getting this negative stuff out clears the path for some gratitude.
Yes, recognition of the positive. I think even especially when you're saddled with something as heavy as chronic illness, it becomes almost necessary as like a counterbalance to remind yourself. But yeah, just as you're saying, you have to almost like clear the windshield of the negative stuff before you can really see some of the silver linings. I try to think of nothing as all bad or all good, right? There's always a little bit of both in every corner. Beautiful. Well, thank you so much for sharing. If anyone else wants to share, please pop on, or if anyone has any questions.
I'm willing to share, I guess.
Oh, that'd be awesome. Thank you.
There's my picture. So on this side is a little hard for me to see while I'm looking, but so this is, kind of my depiction of chronic pain experience and other associated mental and emotional stuff that goes along with that. And then on this side, I just documented some of the different kinds of responses that I, hear from people. Like a lot of people, they don't know, they're not familiar with it. So they don't know what they think. They're not sure. Some people have been there. A lot of people have been there. And so, they can relate, even though it's not exactly the same, or it's not your specific trip. There's a lot of people who know in one way or another. Some people feel sorry for you, which isn't much help, but it's a response that they have. I think in part it's like they wish your pain would go away because it's uncomfortable. Like I kind of get it. It's not I'm not trying to put that down, but it's not super helpful either. From the right person who actually can do something to help, it's great. For people who aren't like local enough or whatever, there isn't much they can do, right? Like they can be your friend and that's cool, and on it goes. So yeah, so those are my pictures.
That's fantastic. I think those are powerful things to put on a page. I'm curious how it felt to create that. And I'm also curious, what is the best response, if you're telling someone about your illness and your condition, what response do you hope that they have?
That's a good question. I guess and I don't know if this is exactly an answer to your question, but it's kind of related to the topic of stigma. And the question that came to mind for me is a lot less about what society does and is more about what do we do? Like how do I process that and not get tangled up in that trap? It's great if the rest of the world is going to wake up and all that, but like that's a hard rock to push. How I respond to things, though, that's something that I can do something about. And one of the things that I've thought about is that like I don't worry about ableism in our culture. I've been debilitated 3 times for long periods of time in my life. It's like if that kind of comes towards me, I'm like, okay, just wait. Like, we all are going to experience some version of this, unless you're like super lucky and you live to 95 and you never have any health problems. But
Yeah, of course.
like,
The
that's
few.
just not the real world. It's just helpful for me to think about like, how do I respond to it? Like, I can see how it's demotivating to people, in terms of like, oh, I don't want to go seek treatment because I'm demoralized by it or whatever. But at some level, I think we as individuals, like we got to take care of ourselves, and do what we need to do, and I'm not trying to like say it's acceptable or dismiss it either. It's real. But yeah, I'm just interested in like, what do we do about it? I think in terms of like what people did or have done that's been helpful, um, is basically just check in with you, like a
That
lot of
emotional
times
support.
there's not much somebody can actually do.
Mhm.
Sure, people could run to the grocery store for you, and people did that for me for a long time. Uh, but it's just nice to know you have a friend, like somebody who checks in, sees how you're doing, doesn't freak out if you're all messed up, you know,
Of
right?
course.
Like, yeah.
I think in your initial statement, you hit on something that's also empowering, because what you're doing is focusing on something that you can control and how you respond. And so that's something that I think can actually counter the kind of demotivational stigma, because you're now empowering yourself to think, well, how am I going to respond? How am I going to take this situation? So similar to what Kate was saying, of kind of coming back to the positive and as a counterbalance, this is something that people can think about in terms of empowering themselves, and also, figuring out how to include it in art and making art a representation of both sides of the coming back to this counterbalance and idea, because nothing is all one-sided. I will describe to you what I did, and then we can wrap up. On one side of the page, I just have a large lightning bolt, and then I have my 20s, which are all scratched out because I feel like all of my 20s have been totally capitalized by chronic illness. And I have this door that says knock, knock, but don't open. Um, and then on the back, I just have this black box and it says you good, because a lot of times I feel like my chronic illness is so complicated and messy and so big, but when I try to convey it to people, or when I hear people tell it back to me, it's this very like simple, concrete, like, oh, you have it, but you're fine. And it's just kind of your thing that you manage. And I perceive it as such a small part of who I am. And for me, it feels so big and like this lightning bolt in my day-to-day life. That's kind of my perception on my illness and how I have tried to bring out some representation in my own art. But yeah, I wanted to say thank you guys so much for being here today, especially thank you for Kate and John for sharing. It was really wonderful to spend some time this morning with you. And unless we have anything else, I think we're going to wrap up.
If you created something and get time to share today, feel free to email or text or whatever, whatever you find Morgan on social media. Thank you so much, Morgan. This was really great, and really appreciate your your intervention and like being able to collaborate with you through the show in this way. If you're interested in this kind of programs, please, check out the recording of previous talks and the long list of upcoming programs that we have with artists who are also medical professionals and healthcare researchers. Thank you, everyone. Thank you, Morgan.
Awesome. Yeah, no, thank you so much. I just put my email in the chat. If anyone wants to grab that, feel free to contact me. My favorite thing is connecting with other people with shared experiences. So don't hesitate and have a great day.